Welcome to the deep dive.
Great to be here.
All right, so today, forget wading through dense textbooks. Our mission is pretty clear. We're taking information straight from veterinary polycystic kidney disease and, boiling it down, the essentials.
Get him right to the point.
Exactly. We want to give you a really clear picture of what is, honestly, a pretty significant health issue, often hidden, affecting some of the cats and dogs we really love.
Yeah, consider this the fast track to getting informed on this specific topic.
Okay.
We're talking polycystic kidney disease, PKD, in animals.
Yep.
And as our source material highlights, it's complicated
Yeah.
and really relevant if you have certain breeds because often it's inherited.
Inherited. Okay, let's dive straight in then. Based on the source, what exactly is polycystic kidney disease? What's happening inside the pet?
So the source defines PKD as basically a disorder where you get multiple cysts forming, and these cysts eventually replace big chunks of the normal, healthy kidney tissue.
So they sort of take over.
Pretty much. And they aren't just random sacs, they actually grow within the existing kidney structures.
Wow.
Specifically the nephrons and the collecting ducts.
So inside the working parts of the kidney. It's not just like one or two random cysts then, but a more widespread issue.
That's it. And a really crucial point the source makes is that it invariably affects both kidneys.
Both.
Always. Always, according to the source. You won't see it just in one. And importantly, the source stresses that in most cases they're looking at, it is inherited.
That genetic link feels key. Which immediately makes me wonder, are some pets just more likely to get it? Who does the source point to?
Absolutely. The source is quite specific on the breeds, the signalment. In cats, it's overwhelmingly Persians.
Persians, okay. Big one.
Huge. And breeds closely related to them. So that means, the exotic shorthair, Himalayans.
Right.
And the Scottish fold, too.
Wow. Okay, those are some really popular breeds. So if you happen to own a Persian or, a related cat, this is definitely something to know about.
It really is. And the source doesn't stop at cats. It also names specific dog breeds.
Oh. Which ones?
Cairn Terriers and Beagles are mentioned as being more commonly affected.
Cairn Terriers and Beagles. Okay. So, yeah, if you're living with one of those breeds, this deep dive could offer some really important insights for you.
Definitely.
Now, you said earlier it can be often hidden. What signs might an owner actually notice? What does the source say about symptoms?
Yeah, that's a critical point because the source really emphasizes that the cysts can be clinically silent for a long time.
Meaning no obvious problems.
Exactly. They don't cause clear symptoms until they've gotten, large enough, or there are enough of them, to really start messing with kidney function.
Okay.
Then you might see signs of renal failure, or sometimes the abdomen might even look physically bigger, enlarged.
So in those early stages, the pet could seem totally fine.
Absolutely fine. The source states patients are typically normal while the cysts are just beginning to form. The signs really come later.
And during a vet check, could a vet feel something?
Possibly. When a vet feels the abdomen, they might notice the kidneys feel different. The source uses the term bosselated.
Bosselated?
Yeah, it just means lumpy or bumpy because of the cysts underneath the surface.
Lumpy kidneys. Okay, I can picture that. Does it hurt the animal? Are they painful?
Generally, no. The source clarifies the cysts themselves usually aren't painful when felt. Pain really only comes into play if there's an acute secondary infection.
Infection again.
Right. If a cyst gets infected, it can swell up fast, stretch the kidney's outer layer of the capsule, and that can be painful.
Got it. So usually not painful unless infection complicates things.
Yeah.
Let's circle back to the inherited part. What does the source tell us about the cause and risk factors besides just the breed?
Yeah, the inherited aspect is strongly highlighted, especially that autosomal dominant pattern in Persians.
Okay.
The source even gets really specific, mentioning a particular genetic mutation. It's a single letter change in the DNA cytosine to adenine that basically tells the gene to stop reading too early.
Like a typo in the instruction.
Right. Kind of, yeah. And that specific typo is strongly linked to PKD in Persians.
Wow. But is it just the genes? Or does the source mention other things that might, push it along or trigger it?
That's where it gets a bit murky. While the genetics are definitely key, the source does note that the exact triggers for why the cysts start forming aren't fully understood. They suggest it's likely a mix. Genetics, yes, but also things happening inside the body, endogenous factors, and maybe even environmental factors play a role.
Environmental factors.
Hmm.
For kidney cysts,
Yeah.
that seems surprising. What sort of things?
Well, the source lists a couple of chemicals that have been flagged as cystogenic, meaning they could potentially cause cysts. Examples given were diphenylthiazole and even things like long-acting corticosteroids.
Corticosteroids, like prednisone.
The long-acting injectable types were mentioned, yes. It suggests it's maybe not just the gene alone, but how it interacts with other stuff.
Fascinating. Such a complex picture, genetics and environment. Okay, so let's say a vet suspects PKD. Maybe they felt those lumpy kidneys. How do they confirm it? What's the diagnostic process according to the source?
Well, the first step, like with most things in medicine, is thinking about what else it could be, the differential diagnosis.
Ruling other things out.
Exactly. The source lists quite a few possibilities, other types of inherited cystic kidney diseases, some specific breed issues like in collies or German shepherds,
Okay.
cysts that can just pop up with chronic kidney failure or abnormal kidney development, or even things that aren't cysts at all, like tumors or urine blockage, hydronephrosis.
So quite a list to work through. What about the standard stuff? Blood tests, urine tests, do they help?
Usually not in the early stages, according to the source. Standard labs, CBC, biochemistry, urinalysis, they tend to look pretty normal.
Really? Even with cysts growing?
Yeah, results usually only change if the disease has progressed enough to cause actual kidney insufficiency. The source also notes that blood in the urine, hematuria, is actually rare with PKD.
Okay, so basic labs aren't the main thing early on. Are there more specific tests then?
This is where it gets really useful, especially for cats. The source highlights that genetic test.
The one for the specific Persian mutation.
Exactly. The test for the ADPKD type 1 mutation, autosomal dominant polycystic kidney disease type 1. It's described as incredibly helpful.
How so?
Well, for screening really young kittens, under maybe 3 or 4 months old, at that age, ultrasound might miss very small cysts.
Right, too early to see them reliably.
Correct. And it's also good for confirming which type of inherited disease it is in breeding cats that already show cysts on an ultrasound. But there's a caveat.
Always a catch.
Well, the source points out that this test is only for that specific mutation. Other genetic mutations could potentially cause inherited cysts too. So a negative result on this test doesn't absolutely guarantee the cat is free from any form of inherited PKD.
Ah, okay. Still a powerful tool, though, especially for breeders. What about looking inside? Imaging, x-rays, ultrasounds.
The source says standard x-rays, or even x-rays with contrast eye, aren't very good for actually seeing the cysts. They're not sensitive enough.
So not the first choice.
No.
Yeah.
But ultrasonography, that's described as the key diagnostic tool, the go-to.
Ultrasound, right. What does the vet actually see on the ultrasound screen?
The source describes these characteristic anechoic cavitating lesions.
Okay, translate that for us.
Basically black spots. Anechoic means no echoes, so fluid-filled cavities show up black. They have sharp, smooth walls, and behind them you see this brightness, distal enhancement, which confirms it's fluid. Seeing those specific things on ultrasound is considered diagnostic for PKD.
Very clear signature then. And can ultrasound pick it up early?
Yes. The source mentions cysts have been spotted via ultrasound in kittens as young as 7 weeks old.
Wow, that's early.
It is. But they also caution that screening cats younger than about 6 months can lead to more false negatives.
Meaning the test says it's clear, but the cysts are just too tiny to see yet.
Exactly. Ultrasound is also useful because it can help tell PKD apart from other kidney issues by checking other organs. In the inherited ADPKD form, it's common to see cysts in the liver or pancreas too.
Okay, so ultrasound is definitely king for imaging here. Any other procedures mentioned for diagnosis?
Just briefly, the source mentions that sometimes taking a tiny sample with a fine needle aspirate from the kidney can help differentiate cystic disease from other things causing kidney enlargement.
Okay, so diagnosis made. Now the big question, what does the source say about treatment? Can you, get rid of the cysts?
Yeah, this is the tough part. The source is very clear on this. Eliminating the cysts and the damage they cause, it's not yet feasible.
So no cure, no way to make the cysts disappear.
Not currently, no, not in terms of reversing the changes. The focus of treatment, according to the source, has to be on managing the fallout.
The consequences.
Exactly, minimizing the negative consequences. So managing chronic kidney disease if it develops, treating any kidney infections, dealing with blood in the urine if that happens, and managing pain.
What about trying to drain the really big cysts? Does that help?
The source mentions it. Draining fluid cystocentesis, or surgically creating an opening for drainage fenestration, can potentially help with pain from stretching or reduce pressure on the good kidney tissue. But they know it's just not practical if the kidneys are full of many cysts. You can't drain them all.
Makes sense. Just too widespread. What about something drastic, like removing a badly affected kidney?
Nephrectomy, kidney removal. The source says that's really only considered in very specific, severe situations. Basically, if infected cysts are causing sepsis, a massive, uncontrollable infection throughout the body.
The last resort, then.
Pretty much.
Since it's often inherited, especially in Persians, what about trying to breed it out? What does the source say about prevention through breeding?
It addresses this, particularly for Persians. It points out that completely getting rid of the disease just by selective breeding, removing affected cats from the gene pool, might actually be impossible.
Impossible. Why?
Because, according to the source, estimates are that nearly 40% of Persians are affected.
40%, that's huge.
It is. And trying to exclude that massive chunk of the breed population from breeding could seriously shrink the gene pool, reduce genetic diversity.
Right.
Which could lead to other genetic problems down the line.
Wow. Yeah, that's a massive dilemma for breeders.
Yeah.
40%. Do the cysts ever just go away on their own?
No.
Shrink?
No. The source is quite definitive here. Spontaneous resolution cysts just disappearing hasn't been seen in dogs or cats.
Oh, they stick around?
They stick around, and they usually get bigger and more numerous over time, which unfortunately means more compression of the normal kidney tissue.
Right, so they progress. Okay, you mentioned infection-causing pain earlier. If a cyst does get infected, are there, special tricks to treating it with medication, antibiotics?
Yes, absolutely. The source points out that bacterial infection of cysts, while rare, needs a specific approach.
Why is that?
The challenge is the environment inside the cyst. The fluid can be acidic, and the cyst wall itself acts like a barrier. So many common antibiotics, especially the acidic ones like, say, penicillins or cephalosporins, struggle to get inside the cyst fluid at high enough levels to actually work properly.
They can't cross the barrier or survive the acidity.
Pretty much. So the recommended approach, based on the source, is to use antibiotics that are alkaline, the opposite of acidic, and also lipid-soluble, meaning they can pass through fatty barriers like the cyst wall more easily.
Okay, which types are those?
The source gives examples like trimethoprim sulfonamide combinations, fluoroquinolones like Baytril, chloramphenicol, tetracycline, and clindamycin.
And they work better because?
They can get into the cyst, and interestingly, once these alkaline drugs get into the acidic fluid inside, they tend to get trapped there, ion trapping. This helps them reach higher, more effective concentrations right where the infection is.
Ah, that makes sense. A really important detail for vets managing that complication. Okay, so once a pet has PKD, what's the long-term look like? What about follow-up?
Regular monitoring is key. The source recommends checkups every maybe 2 to 6 months.
And what are they checking for?
Mainly looking for those associated issues popping up. So signs of chronic kidney disease progressing, any hint of renal infection, or indications of pain, keeping tabs on things.
Right. And overall, what's the outlook? The prognosis?
Well, the source suggests that as long as there isn't a severe complication like sepsis from an infected cyst, the short-term prognosis actually seems favorable, even without a direct treatment for the cysts themselves.
So it's manageable for a while, focusing on the side effects.
It seems so. It's really about managing those secondary problems as and if they arise.
Okay, wow. We have definitely covered a lot of ground today, a real deep dive. Taking insights from veterinary polycystic kidney disease, we've touched on, well, what PKD actually is, those specific breeds most affected.
Especially Persians, Cairn Terriers, Beagles.
Right. The often subtle signs, that fascinating mix of genetics, like that specific mutation and maybe environmental factors.
How it's diagnosed, with ultrasound being key, plus that genetic test.
The current challenges. The fact we can't just eliminate the cysts.
The specific way to handle infections with the right antibiotics.
And what long-term care and the general outlook involved.
Yeah, the goal was really to distill that source material for you, give you a clear, useful understanding of this pretty complex condition.
And hopefully we've done that. Now, as we wrap up, here's something to chew on, a thought drawn straight from what we discussed. That statistic, potentially 40% of Persians affected.
It's staggering.
It really is. So consider this. How do breeders, owners, vets, how does everyone involved balance that desire to eliminate an inherited disease like PKD with the absolute need to keep a breed genetically healthy and diverse?
It's a huge challenge. No easy answers there.
Definitely something to think about.
Yeah.
A real balancing act with big implications for the future of these breeds.